minutes after 11 o'clock. Thank you for tuning in. I know some of you heard us talking about the fact that we've got some experts going to give you some information about how to be more heart healthy, and we, in fact, do have that happening right now. They all happen to be really pretty, too, which is good for my heart, Rob. It's always good.
They smell great.
And they smell good. They look good. Yeah. I don't know if this is good or bad for a man's heart. I'm not really sure how that works, but I'm okay with it. Let's see. In the studio, first of all, let me tell you, Brittany Marthaler is here. She's the communications manager at Ocala Health, and Ocala Health and Strive Physical Therapy are the folks who bring us these great guests every other week or so. And so, Brittany, thank you for doing that.
Thank you.
How are you? And you're going to Georgia? That's so cool.
Yes. Yes.
You have brought with you Chrissie Wilson. Used to be a singer, I think, right? No. and Michelle Hodges. Chrissie, you're a registered nurse with Ocala Regional Medical Center and a member of the Take Charge team. We'll find out what that is in a second. Okay. And Michelle Hodges, Director of Cardiovascular Services here in Ocala at Ocala Health. And we are going to talk about cardiopulmonary rehabilitation, recovery from a heart attack or any kind of a heart event, cardiac event, as well as how to reduce the risk and improve your fitness level overall. So good morning, ladies, and thank you for coming in.
Well, thank you for having us.
And we have a history. You didn't realize it when you first walked in because I have a forgetful memory, but you know, I shouldn't do that. So I guess we'll start with the first thing. What is the Take Charge? What is that?
Take Charge is it's a cardiac rehab program. And what cardiac rehab is, it's a program for people recovering from a heart event, like a heart attack or open heart surgery. And it's an exercise program. It's like a gym. Most of our patients think of it as their gym that they come and exercise after they've had a heart attack or a heart event.
Do they find it, are they cautious? Like, in other words, they just had a heart attack, and now you're telling them to exercise. Yeah.
Actually, that's the problem. Most of the time, patients are so apprehensive, and they don't even realize it when they're in the hospital having the heart attack. I'll discuss with them, you need to start exercising. Oh, no problem, no problem. But usually when they get home and reality sinks in that, I had a heart attack, I don't even know where to begin exercising or what to do. And that's where a referral to the cardiac rehab program is helpful for them, because it helps them gain their independence again, gain their confidence back, figure out, what's appropriate, what kind of exercise is appropriate, and do it, without them being afraid that they're going to cause a bigger problem.
Can I ask you about the pulmonary part? This is probably something everybody knows but me, but cardio and pulmonary are always put together.
Well, your heart and your lungs work together. So the exercise that you're doing is cardiopulmonary exercise. It's exercise for your heart and your lungs. Now, there are cardiac rehab programs and there are pulmonary rehab programs. At this point, Ocala Health only has a cardiac rehab program, but there are cardiopulmonary rehab programs. But actually, if you're exercising your heart, you're exercising your lungs also.
Okay, so somebody has a heart attack and the doctor says you're fine, you can go home now, or whatever statement is made. You go to mow the lawn. So, sometimes just mowing the lawn, you're out of breath and you feel your heart rate increasing, right?
Right.
You panic, you say, oh my God, I might give myself a heart attack, or are we too cautious?
Well, sometimes you're too cautious, but sometimes you're not. It depends the extent of your heart attack. Some heart attacks are really severe and damage the heart, and some people never totally can recover from that. They will always be short of breath when they're doing something like mowing the lawn. The purpose of going through like a cardiac rehab program is to help strengthen the heart. Your heart's a muscle. Heart muscle, when you have a heart attack, what's actually happening is the muscle is being injured. Now, that injury can recover somewhat,
right,
but it doesn't just recover on its own. It usually needs a combination of medication, exercise, change in your lifestyle, like quitting smoking, changing your diet, to help improve the heart. It doesn't just happen overnight. You go into the hospital, have a heart attack, they do a procedure, and you go mow the grass. There's a recovery period that you need to.
So why do any other muscles have attacks?
Yes.
Not heart attack, but could I have an arm attack or?
You can get some ischemia to areas of your body, but the most common is your heart, your brain. You can get ischemic kidneys.
You can have a brain attack?
Yeah, a brain attack's a stroke.
Oh, okay.
Stroke is a brain attack.
But the scar tissue and this is something this is where I'm really leading to with my question, which probably was dopey. But I mean, if a heart attack leaves scar tissue on the heart, and that scar tissue makes your heart less effective, right? And your heart is a muscle, why doesn't it happen with any other muscles, or does it?
Well, it does, but I don't think it's as dramatic as it is.
Because you're not going to die if you have a scar tissue on your arm muscle or something.
Right.
Okay.
Right.
Okay.
And it does happen to your brain, and that's a stroke, and that's why people sometimes that have had strokes have residual, memory loss or inability to speak and things like that. Yeah. Brain attacks and heart attacks, they're like cousins. They, just different blood vessels are causing
I never
them.
thought of it that way.
They are.
They say there are no coincidences. Have you ever heard this? They say there are no coincidences, right? Mm-hmm. Then I read that the brain is 18 inches away from the stomach. And I said, now that sounds like a coincidence. I can't believe that there are no coincidences when you know that fact. I mean, why would God make the same distance between your heart and your stomach the average size of a large pizza?
Oh, that's where he's going with
it. It doesn't make any sense. Oh, did I leave that part out of my joke? Sorry. I didn't tell my joke right, Brittany. Large pizza is 18 inches. Okay. So tell me, what's the truth about the aspirin therapy? Is that good stuff? Because I heard usually you hear that's what you should do, and then I heard something like 2 weeks ago that said they've changed their mind on that whole thing.
Yes, I mean, typically aspirin therapy is something that's, recommended for a lot of patients, absolutely. There's, aspirin, there's other medications other than aspirin that are sometimes, recommended as far as thinning the blood and those types of things. But yes, many patients are on aspirin and will continue to be so.
Do you need to know that before somebody enters the Take Charge program?
If they're on aspirin?
If they're doing anything that thins the blood?
We generally do know. See, the Take Charge program is a medical program. It's medically supervised. So when a patient comes to our program, they are going to have a history done, a physical. It has to be referred by their physician. We know what medications are taken.
So there are doctors there while you're exercising?
Actually, it's supervised by a cardiologist. We have a cardiologist that's our medical director. He's not always on the premises, but he's always readily accessible, and we are on the hospital campus.
Are you wired? Is the patient wired? Okay.
They wear a...
So you would really have more, what do you call it, biofeedback than at a normal gym?
Yeah, we do a lot. The patients are never alone while they're exercising. There's always a nurse or an exercise physiologist, actually within sight of the patient while they're exercising.
Well, before any of these procedures are done, can the person experience the Take Charge program before the operation?
They can, and sometimes patients are referred to us before. We see patients many times that are going for like a heart transplant, and they have to they need to get their strength built up before like a heart transplant, or a doctor is wanting to find out what brings on their angina attack, and they'll have them come to Take Charge before they even do a procedure.
What does that word mean? I've heard it all the time. Angina.
Angina is just, it's like the warning sign of a heart problem. Most people think of angina as chest pain. I prefer to call it angina because I can ask one of my patients, tell me about your chest pain, and they'll say, well, I never have chest pain. I get short of breath, and then my arm starts to ache, and it goes into my elbow, and I get a little indigestion, but I never get chest pain. Well, that's their angina symptom.
Oh,
so
okay.
Angina is just like the group of symptoms that patients have.
Because, and I don't know if this is still true, but you used to hear people say, oh, I heard you had a heart, or I was worried I had a heart attack, but my doctor said, no, it's just angina. So is that accurate? I mean, is that a lesser thing to have?
Oh, absolutely.
Okay.
A heart attack actually is when one of the blood vessels that feeds your heart muscle clogs off all the way and cuts off the circulation. The muscle starts to die because it's not getting any blood flow to it.
Oh, wow.
So that's a heart attack. That's usually what causes a heart attack. An angina attack can be because the artery is narrowing and the blood flow's limited, but the muscle's not dying.
And is that reversible or repairable?
Oh, sure.
Always with surgery, or does eating or anything else non-surgical help?
Well, I mean, certainly surgery is a treatment for some patients, but if you're starting to have some of these warning signs, there's other options if you do need treatment other than maybe having open heart surgery. We have so many technologies today. You've heard many people, they have a stent or they have a balloon angioplasty.
Right.
These are procedures that are not, open heart surgery, but allow the physician to repair that blockage, that's cutting off that oxygen.
What is the stent actually made out of?
The stent can be, some of them actually have like drugs that are like embedded in them.
Really?
Yes, exactly. Some of them don't. And essentially they put them in and they kind of prop open the vessel.
So this is what I
say,
picture when I hear a stent. I might be totally wrong, but I need to know. Have you ever had a fish tank?
Yes.
Okay, those tubes that come out of the pump?
Yes.
In order to connect the tube to another tube, you have this little thing that goes between the two?
Like a connector.
Is that a stent?
Not exactly.
No.
I prefer to think of it like the spring from a ballpoint pen.
A little coiled
Yeah,
type
the
of
little
thing.
spring. It's metal and it's flexible like
really?
that. Yeah, and it's hollow. And what happens is the doctor puts it's actually around a balloon catheter, which is just a tubing. You got the tubing part.
Got
right.
that part, okay.
Got that part right. And they get up to where the blockage is,
Right.
and they actually blow the balloon up. And wrapped around that balloon is this piece of metal that's
Wow.
kind of like a spring from a ballpoint pen. Actually, sometimes when I'm explaining it to a patient, I'll open up my pen and show them the spring.
Right.
It's similar in size, very similar in shape. And so when they blow that balloon up, it just expands that spring, that stent, and it holds
stays there.
And how do they get there? I mean, is your chest wide open or?
No.
But that's the old way, right? Isn't that the old way?
No.
No?
It's a different procedure.
Yeah,
Okay,
much
okay.
easier.
Yeah,
much
that's
easier.
heart surgery.
Yeah.
They actually have to go through a big blood vessel in your groin, most often in your groin. I know that
Yeah.
sounds
Your groin.
kind of strange. You're starting in your
Really?
groin to get to your
It's
heart.
like getting off in
Kind of
Bellevue to get to
pizza.
Daytona.
Yeah, but they're able to feed a little tube up there to the heart. It's done, basically not even under general anesthesia.
Yeah, most
So
patients
it's
are awake.
Very, very easy. They're groggy, but a little tiny puncture into your groin, the doctor feeds up the
When you say
catheter.
your groin, I mean, where?
Basically right here. You have
Right
have
there.
an artery right there in the groin.
It's close.
Oh, yeah, it's close. I did look, by the way, when she pointed. I did.
It's actually a great procedure for the patients. Patients do so
Thank
well.
you for pointing, by the way. That's all I need. Just point. I'll understand better.
Actually, some doctors will even go through the wrist.
Through the wrist. I might ask for that if it happens to me. Can you go through the wrist?
Can't
Can
always.
you stay away from the groin? I think I'd prefer the wrist.
Oh, the Take Charge cardiac team seems like it's a specialty. Do you appoint people to the team, or do they apply for it, the
Well,
medical professionals?
The medical professionals all of the medical professionals are nurses and exercise physiologists that are specialized in cardiovascular medicine. And I've been there for almost 20 years, so I think I'll have to die before anybody else gets to come and take my place. No. Yeah, we don't usually have to recruit any new staff members. We've been there. Most of us have been there quite some time.
Wow. Women are usually way more ahead of us guys in being aware of their own physicalness. But it seems like the heart is the one area where we are more aware than you ladies. Am I right about that?
That is true, and I think some of that difference is a lot of times women experience signs and symptoms of angina differently. A lot of times they're more subtle.
Well, you say it angina.
Yes.
That sounds.
Or angina.
Well, that's
It's all the same.
yeah. The other one's a little uncomfortable.
A word.
Yeah.
This is the A word.
But a lot of times, yes, the symptoms are more subtle, so a woman won't necessarily realize what's happening. But I think, especially over the last probably 10 years, more attention has been given to
So what-
women's heart health.
So what does a woman need to know to look for?
Well, I mean, I think you have to know be aware of your body. If you are having, issues where, you're feeling maybe some chest pressure,
So that's the same as a man, right? Chest pressure?
Yeah,
That's the same.
you can
okay.
even be mild, if you get mildly nauseous, you may not have any symptoms. You might just be very tired, you just feel a little off. And that's really why, especially when the symptoms can be so subtle, it's really important that even if you feel like you're healthy, that you're getting routine care from a provider.
Okay, so you have these symptoms, you go to the doctor, and then what? I mean, I'm trying to bring the Take Charge program into this. Is that always the preventive measure? I mean, you do the Take Charge thing as a way to prevent?
Well, no, not necessarily.
No, okay.
You can do it as a preventative,
Okay.
but we also, most of our patients, we get after they've had a problem, after they've had a heart attack, after they've had open heart surgery, most of our patients, because most people don't know they have heart disease until they have a major event, whether it's a bad angina attack and they have to have a stent put in, or a major heart attack and they have to have stents or open heart surgery. Most people don't realize that they have the heart problem.
Wow.
And most people, if they're going to do a preventative, they're going to end up going to the gym on their own or whatever. So most of them are not going through the Take Charge program until after their event.
And is the Take Charge program included when the patient comes in and they have to have the surgery or the stent put in? Is that all written up on their insurance forms?
Most insurance covers it. Now, what happens when a patient comes to the hospital and they have a heart attack or they just have a stent put in? I will get a request to come see the patient because I do the education with the patients when they're in the hospital, explain to them what's going on, and then I introduce them to the program. They have to be referred by their physician. Now, all the physicians, all the cardiologists through Ocala Health System order cardiac rehab for me to come see them, the Take Charge program, for me to come see them after their procedures. It's their choice whether they decide to move forward and actually participate in the program where they actually come to the hospital 2 or 3 days a week for this exercise program. So it's up to them if they decide that they want to do it. But we do initiate it with every patient after they've had a heart attack, heart surgery, or have stents put in or balloon angioplasty.
So is the heart examined in a normal checkup?
Indirectly, if you're seeing, a physician annually, they're going to monitor such things as, your lab work. They're going to monitor your blood pressure. They're going to, know if you have diabetes, and all of those things, if they're not in balance, are risk factors. So if you have someone that has high cholesterol, then at that point the physician can hopefully do some preventative maintenance, put you on a statin, encourage you to have a healthier, diet, control your weight. If you're a diabetic, having your diabetes in good control. All of those things will help you hopefully stay out of the hospital.
Right.
But if they're uncontrolled, then it may indicate that you need further testing. They'll probably do an EKG, a lot of times on a routine visit, and that in itself can certainly pick up some potential heart injuries.
Right.
And then in that case, then there's, further steps. And we have so many diagnostic testing options nowadays. We have motion pictures of your heart, typically called an echo. We can actually see from the surface, just like you see when you're looking at a baby when you're pregnant. We're able to look inside the heart and look and see how it pumps and look at the valves. So,
since you focus on prevention also and preventative measures, how young does a patient have to be before they can see you?
Really any age, and I think a lot of it also depends on your family history. And there's certainly people that are born with congenital heart defects, and so they have a completely different course. But in general, if you feel like you've been healthy, I would for sure, at least in your 30s, make sure that you establish with a physician and that you're getting regular checkups.
I just want to say, Chrissie's mom used to work for WOCA, and once upon a time we had a guest on, and I'm bringing this up because it actually interfaces with what we're talking about. I don't know if it was this particular author, but I remember you called in or something and said something to your mom to relay to us that you didn't exactly agree with the author, which is not unusual. We have a lot of authors that bring
the spot.
No, nothing wrong with that. But the question I remember having was, and I don't know if it was this author, but when they say you should eat vegetables instead of meat, when they say the cholesterol and all this, and then they say it clogs the arteries. I've often asked the heart surgeons. We had who's the big German guy that does heart surgery over the?
Is it Dr. Kuykendall you may be thinking of?
Is that who we're thinking of?
No, it's...
he's like my height. He's gigantic, like me.
I can't remember his name.
But anyway, I asked him if when you actually looking at... What's his name?
Gaudier?
Yeah, maybe. Yeah, he's got a French name.
He's French.
Oh, French.
He's got a
Yes,
French name, but he's a German guy.
He's a
Yeah,
neurologist.
Gaudier.
Yeah, Dr. Gaudier.
No.
I can't remember his name.
He's
but we've had
got a
him in
French
the
name, but he's a
studio
German
before.
guy, and he's a big guy.
Gallet?
Yeah.
Okay.
You know,
He's okay.
you're glad he's a friend, right? But anyway, I remember asking him, when you open somebody, actually have their heart there, and you're looking at their arteries, can you tell if somebody's been eating poorly? And he said, yes. So then the big question was, if they changed their eating, could that reverse? Could that artery become more healthy looking? And I don't remember the answer. And that might have been what you called up about.
Well, no, I mean, you cannot reverse.
You can't.
You can slow down heart disease, but what's there is there.
Really?
You're not gonna, very rarely, if ever, do you see a blockage. If a doctor identifies a blockage, it being like 50 or 70%, just with medicine or diet and exercise, are you going to decrease that blockage? Now you can slow it down, and that's really my goal when I speak to patients is change your lifestyle now. The doctor fixed you now. And you can slow down this process, because heart disease is a process. It's a constantly moving, evolving process. It's not stagnant at all. So you can slow it down, but you're not going to stop it, and you're not going to get rid of what's already there.
Okay. But if you've had a heart attack, rehabilitation obviously is your road to having a normal life again, right?
Absolutely.
Which is kind of what, the focal point of today's interview.
Absolutely, yeah.
And are you right in the hospital?
Yeah, where are you?
Both
We
hospitals?
we just recently moved to West Marion Community Hospital out on 200, 4600 Southwest 200. 4600?
4600 Southwest 46th Court, but it is right off of State Road 200.
Right,
Okay,
that's
okay.
right. And I didn't actually know the address. It's in the medical office building that is connected to West Marion Hospital, and we're in Suite 280.
Oh, okay.
Yeah.
All right. And do you want to give a phone number to
Sure. It's 401-1410. It's the same phone number that we had in our other location. So any of our old patients that are out there listening and want to call in, we're just in our new location. We same people, same great staff that we've had, but and we still have the same phone number. So.
And if a person doesn't have a doctor and they want to get one, can they call you?
They can call our consultant nurse line. That's 800-530-1188. And we also have a family care specialist, a group of primary care physicians that if you do not have one, they'd be happy to see you. You can call that number, or you could also go online to their website and book an appointment right from the website. And that's ocalahealthfcs.com.
By the way, we bumped into Dr. Leninrad the other day. Remember Dr. Leninrad, the guy from Australia? He was giving me advice on how to exercise and all that, and what to eat. And we were walking into the racetrack gas station to get ice cream, to get that yogurt. And guess what? He was holding one too. He was on his way out.
Well, thank goodness it was yogurt. And not,
I see, and this is another thing. Is that really a big difference for your heart? I mean, the low-fat stuff versus the... Oh, really?
Yeah, definitely.
It definitely has less fat.
Why is yogurt better than ice cream?
It's
Because of the fat content, I guess.
We don't know. It's just what we believe.
That's what we dietitian told me that. Dietitian told me that.
That's my way of thinking too.
I trust my dietitian.
Yeah, it's like a mechanic, right? Well, thank you once again for coming in. Michelle Hodges, thank you.
Thank
For
you.
coming in. And Chrissie, thank you. Good to see you
Thank you.
again.
Good to see you too.
And of course, Brittany Marthaler, thank you for coming in. Have a great 4th of July weekend, everybody.
Thank you. You too.
And don't get too excited when you see the fireworks. You know it could cause a heart attack. And if the grass needs to be cut and you had a heart attack, get a kid to do it.
That's right. Pay him well.
Get it again. $20. Kid will be happy with $20. You kidding? All right. Thank you again.
Thanks a lot.
And this video will be available on Facebook as soon as we get it up, usually by 2 today. So, all right, we will take a little break and we'll be right back. This is The Source, WOCA Ocala.
Fox News Radio, I'm Karen McKee.